Hey guys, it's Dr. Adam. I wanted in this short video talk a little bit about airway and growth in kids, and specifically focusing on sleep apnea and mouth breathing to give you a kind of a base understanding of this area and kind of an understanding of how orthodontics can tie into or help with that. So let's get started. So for my goals for today is to kind of describe what is obstructive sleep apnea, what does that look like in kids, is there a link between sleep apnea and cognitive ability or mental abilities, and how does airway affect facial growth? And then in our future videos, we'll talk about what the dental profession can do to help. So when we think about sleep apnea, there's different kinds of sleep apnea, but the one that we're kind of talking about today is obstructive sleep apnea, meaning you can't breathe when you sleep because there are things obstructing the airway, and that can be in different areas. It can be in adenoid tissue, it could be in tonsil tissue, and it can be in other areas. Now, what's interesting is there are some links with sleep apnea and other things. So 25% of kids diagnosed with ADHD have some type of symptoms of obstructive sleep apnea. We think a lot of kids don't get enough sleep, and a good percentage of kids snore, up to 3 to 12% of kids. And kids really shouldn't snore consistently. If it happens with a cold or some allergies, that's understandable, but not a consistent snoring. So some of the signs or symptoms of sleep apnea are snoring, mouth breathing, thick gingival gums, a tongue thrust or an anterior open bite, oral habits such as a thumb or finger sucking habit, bedwetting, dark circles under the eyes, behavior issues or concentration or ADHD could be a symptom, tooth grinding can also be a symptom as well, and there are further symptoms as well. Some kids who are overweight can suffer from sleep apnea. Sleeping behavior, if kids have night terrors, they thrash around in bed or have bedwetting or sleepwalking, those can all be associated with sleep apnea as well. And believe it or not, sometimes kids will have chewing problems or avoidance of certain foods, often because of textures. Behavior issues and concentration ADHD are also a common symptom of kids who have sleep apnea. So let's talk a little bit about snoring. Up to 3 to 12% of kids snore, and they think there could be some links with snoring to ADD or ADHD and other problems. So in a study of almost 900 kids ages 2 to 13 years old, they found out that kids who frequently snore or have sleep disorders are twice as likely to suffer from ADHD. They think this is due to a lack of oxygen in the developing brain. Now what gets a little bit more interesting is when we look at cognitive ability and sleep. So in a different study of about 1,000 kids ages 5 to 7, they actually did a sleep study with them, with the leads and everything like that, and then they looked at their AHI score, or apnea-hypopnea index, how many times they stopped breathing or didn't breathe as much as they should through the night. And then they also gave them a series of tests, which tested things such as intellectual abilities, attention, memory, language, executive development. And the real interesting thing is this blue part right here. So after they adjusted for certain confounding factors, they found that kids with moderate to severe sleep apnea, disordered breathing, or an AHI of more than 5, were significantly more cognitively impaired than those with lower levels of the disease, and they found that there seemed to be a dose response dependency to this. So you can see that good breathing during sleep is super important for kids and they're growing. Now let's also talk about mouth breathing and some of the signs and symptoms of mouth breathing. And they're very similar, so they can be thick and large anterior gingiva, dry mouth and lips, or an anterior open bite, sometimes a really narrow palate. And we often talk about kids who have mouth breathing that they develop like a long face syndrome. They can also have dark circles under their eyes. So a visual representation of this from the Journal of Respirology is something like this. And they'll say, okay, sometimes these kids will lean their head forward in an effort to open their airway. They may have crooked teeth or a narrow face. They may have dark circles or bags under their eyes. And they say that this evidence of an airway obstruction kind of results in this growth pattern. So if we look at young kids, what this looks like, you'll see here is a picture from orthodontic records. He's got his chin kind of leaning back. We notice he has a tongue thrust in this picture. He may have some thick gums, it looks like. He's got an anterior open bite. So all these could be symptoms of someone who's a mouth breather. Now why is this important? Because mouth breathing is related to growth. So if you have good airway, you often get good growth, and a good airway is related to proper facial growth. Whereas if you have maybe mouth breathing or poor airway, you can get poor growth. So we kind of joke, how is this possible that Neville Longbottom turned into this? We got good growth, right? Now the other side of this is in an ENT journal. I got this is a picture of a young girl age 6, and for them, they're looking at her tonsils and adenoids were so large that she couldn't breathe well. Okay, so the question is, what can we do for kids that have maybe obstructive sleep apnea or poor airways? Well, one of those things we can do is we can actually expand the upper and lower arches. And in the next video, we'll talk about why that's helpful and why that's important. But this just gives you an idea for young kids, one of the things we can do. And we often get the question is, when should my kids see an orthodontist? Here's my two kids. One of them is holding up the number 7. And we want to see kids starting at around age 7. And there's several reasons for that, which we can go over in a later video. And the other question we often get is, do I need to wait for my dentist to give me a referral? No, you don't. We'd love to see all kids and to do an exam and look at some of their airway and teeth issues. And we can talk about that in the next video of what are those things that we look at and how is it helpful. All right, thanks so much.